So children.
Yeah.
And Invisalign. So kids, 6th grade, 7th grade, can get Invisalign?
Yeah, no, I actually, in fact, I encourage them come earlier. The earlier, the better, because a lot of time we're able to look at the case and set it up for future success, meaning that they don't have to actually go through all that stuff while they're in high school. A lot of time there might be just a minor fix here and
Like
there.
at what age? Like talking to the parents right now, when should you get your child?
So as
ortho?
soon as that they have adult teeth coming in, I would say between 8, 9, 10 years old. As early as that. And we're able to actually start looking at the diagnosis, what we can do to help you or help the parents decide what direction we should go. And a lot of times, when you look at the kids and they don't smile, something's going on. Now, is it because self-esteem, or is it because they're not happy with their teeth and their smiles? So that's what
So
we
if
can
your
act on.
children aren't smiling in photos,
Yeah.
chances are they don't like their teeth.
That's a highly possibility. It's the same thing with a guy who has a belly. When they take photos, they put a blanket over that.
Or they pose with their kids in front of their stomach.
Exactly.
That's what I used to do.
Exactly. So, and when we do that, we assess the patients. And that helps. We'll walk through the parents, and sometimes the parents are not. It's the unknown that they're fearful. But we don't just start the treatment. I'll guide them what needs to be done, and we can slowly progressing into that process.
Well, if you're in high school and you had a choice between Invisalign and braces,
yeah,
Invisalign for the students would rather go Invisalign.
Oh, absolutely. I mean, that's a common misnomer. Patient, especially teens that comes in, they think that, oh my God, all my friends are in bracket and wires. I want to have that, but they don't realize that bracket and wire is a lot more maintenance. You have to brush better. You have to come cleaning more better. In fact, with a bracket, if you have a bracket with a teeth on, you get food traps around it. A lot of time when we finish with the case, they end up getting cavities. Invisalign, you don't have to worry about that because you can take them out, floss, brush the same way you do. Okay. Much easier to maintain.
So if a kid's wearing regular braces, tries to eat popcorn or chewy things, they get stuck in there.
Yeah, and that's
With Invisalign, you just take them out and eat,
you can eat
and put them back
on.
on.
So one of the best advantage with Invisalign is there's no restriction in food diet. So you could take them out, you can eat ribs, popcorns, you can eat corn on the cobs, you can go on, eat gums, chew gums, things like that. All the things that teenagers like to do. So absolutely there's no restrictions.